All right, let's get real and talk about something that a lot of diabetes educators, well, they kind of gloss over it: alcohol. It's one of the first questions people ask, but the answers you get are often super vague. Can you actually drink with diabetes? The short answer? Yeah, usually. But there's a really terrifying hidden danger that nobody, and I mean nobody, warned me about when I was first diagnosed. So let's break it all down the honest way.
So, this is the big question, right? Can you still have a drink? It's completely valid. You want to live your life, go out with friends, and not feel like your diagnosis is a life sentence of saying no.
And the answer for most of us is yes, you absolutely can. But, and this is a massive but, there's this hidden danger that just isn't explained well enough. It's a risk that doesn't pop up right when you're having fun, but hours later. When you're home, you're asleep, and you are totally unaware. Understanding this part, it's not optional.
And this danger has a name: delayed hypoglycemia. This right here is the absolute core of what makes drinking with diabetes so different and, yeah, potentially risky. Everything else we're about to talk about revolves around understanding and preventing this one specific thing.
So what is it exactly? Well, delayed hypoglycemia is a severe, dangerous crash in your blood sugar. But the tricky part is when it happens, 6 to 24 hours after your last drink. The real threat isn't when you're feeling a bit buzzed, it's long after, when you think the night is over and you're in the clear. And most dangerously, while you're fast asleep. So why on earth does this happen? This quote right here sums it up perfectly. Think of your liver as having two really important jobs for this conversation. Job 1, get toxins like alcohol out of your body. Job 2, release a steady stream of sugar to keep your blood glucose stable, especially when you're not eating, like overnight. But here's the catch. Your liver can't do both jobs at the same time. And when alcohol shows up, your liver treats it like a top priority threat and drops everything else to deal with it. Alcohol always, always wins that fight for attention. And this creates this weird two-phase roller coaster for your blood sugar. In the first few hours, your blood sugar might actually go up thanks to carbs in beer, wine, or sugary mixers. But then, as your liver gets busy processing that alcohol, it slams the brakes on releasing sugar. That's when your blood sugar starts to fall. This brings you into that peak danger zone, anywhere from 6 to 24 hours later, where a really severe hypo can happen out of nowhere. And this is what makes it so incredibly scary. Just look at this list. The symptoms of a severe low, confusion, dizziness, slurred speech, drowsiness, are almost identical to the symptoms of being intoxicated. How could you or anyone with you possibly tell the difference? A life-threatening medical emergency can be tragically mistaken for someone just needing to sleep it off. It's a recipe for disaster. Okay, I know that was the heavy, scary part, but knowledge beats fear every single time. Now that we get the why, let's switch gears and focus on the how. This is your safe drinking protocol. These are the rules of the road that will empower you to enjoy a drink responsibly and, most importantly, safely. First up, let's start with the official guidelines from the American Diabetes Association. For women, moderation means no more than 1 drink per day, and for men, it's no more than 2. And here's the key. That's per day, not per sitting or per party. Sticking to this is your single best line of defense.
Okay, but what even is 1 drink? Because let's be real, the glass of wine you get at a restaurant is often way more than a standard 5-ounce pour. This here is what the experts mean: a 12-ounce regular beer, a 5-ounce glass of wine, or a 1.5-ounce shot of liquor. You have to know these measurements to actually track what you're drinking and stay in that safe zone.
And of course, your choices really matter. Not all drinks are created equal. The better choices are going to be lower in carbs. Think dry wines, light beers, or spirits like vodka mixed with a 0-calorie mixer. You want to be super careful with the sugar bombs, like margaritas, pina coladas, and even regular beer. And hey, here's a pro tip. Try alternating every alcoholic drink with a glass of water. It helps you stay safer and, bonus, helps prevent a hangover.
All right, listen up, because this is probably the most important slide in this entire explainer. These are your non-negotiable rules. Number 1, never drink on an empty stomach. Food slows down how fast the alcohol hits your system. 2, check your blood sugar a lot. Before you start, while you're drinking, and after you're done. This is your data, and data is your defense. 3, this is so important. Eat a bedtime snack that has both carbs and protein. The carbs give you some immediate protection, but the protein provides a slower, steadier source of glucose while your liver is distracted. 4, Set an alarm for 2 or 3 a.m. to check your blood sugar. I know it's a pain, but this is prime time for that delayed low to hit. It could literally save your life. 5. Keep fast-acting glucose right by your bed, within arm's reach. You don't want to be stumbling to the kitchen if you wake up low. 6. Tell a friend you're with what's up. Seriously, explain the signs of a low and how they look just like being drunk. And 7. Wear your medical ID. It speaks for you when you can't.
Okay, we've got to shift gears for a minute and cover some serious medical warnings, because while many people can follow that protocol and be safe, there are some situations where the risks just get too high, especially because of certain medications or other health conditions.
So if you're on insulin, that risk of a delayed low is way, way higher. You've got insulin actively pushing your blood sugar down, while alcohol has put your liver's safety net out of commission. It's a perfect storm. Same goes for drugs called sulfonylureas. These make your body release insulin no matter what your blood sugar is. You have to talk to your doctor about drinking if you're on these meds.
And other common meds have risks too. With metformin, moderate drinking is usually fine, but heavy drinking bumps up the risk of a rare but really serious condition. With SGLT2 inhibitors, both the drug and alcohol can dehydrate you, which is a dangerous combination. Look, the takeaway here is simple. You need to have a very specific conversation with your doctor about your personal medications and alcohol. And sometimes, you know what? The smartest and safest choice is just to skip the drink. If your blood sugars have been all over the place, or if you have issues like hypo-unawareness, it's just not worth the gamble. And a big one, if you're gonna be alone overnight. Don't ever feel pressured. I'm the designated driver, or I'm not feeling it tonight works every time. No explanation needed. So let's bring this all together. Life is full of celebrations, weddings, birthdays, holidays. The goal of all this isn't to scare you into living in a bubble or to say you can never have a drink again. Not at all. The goal is to replace that fear with knowledge so you can make smart, informed choices for yourself. And at the end of the day, this is so incredibly personal. The absolute key is to learn how your body responds, because believe me, everyone is different. And this is where using the right tools can be a total game changer. A platform like Health Gheware, our sponsor, is built for exactly this. You can log when you have a drink, and it will overlay that with your glucose data so you can finally see those invisible overnight patterns. It even uses AI to spot your personal trends and help you figure out your safest choices based on your own body's data. And of course, we have to end with the most important reminder. All of this is for your education. We are not your medical team. You must always talk to your doctor or healthcare provider before you make any changes to how you manage your diabetes, especially with something as complex as alcohol. So I want to leave you with this one question. Now that you know all this, now that you understand the risks, but also the rules for being safe, what is one small change you're going to make to drink more safely? Maybe it's finally setting that 2 a.m. alarm, or maybe it's committing to never skipping that bedtime snack. Just think about it. That one little change could make all the difference in the world.